pleased to introduce the next speaker. We have Professor Dieter Volk, Professor of Developmental Psychology from the University of Warwick, UK, who will talk about the unmet needs of prevention and intervention in 3 examples: infant regulatory problems, prematurity, and bullying. Please, Professor Volker.
Thank you very much for the introduction. Thank you, Giovanni, for inviting me. I will be talking about something different. I will talk a little bit about what I call the Freakonomics of common problems. The first thing, I will talk Freakonomics for the reason that we might change mental health services or might change something in education, but we turn the dial somewhere else where other problems are being created. Or we have got problems which we think they're so common that we can ignore them, but if you start in Buenos Aires with a ship and you want to go to Southampton, and if you're only 4 degrees off course, you end up in Spain. So in the long run, there can come big problems. And the third thing is actually our preoccupation with parents. But a child who has grown up, by the time they're 18 years of age, they will have spent much more time with their siblings or with peers than they will have spent with parents. And somehow we have ignored the influence that peers can have on development. So let me start off with preterm birth. And here you see a preterm child in the incubator, and I'm just trying to work out where I have to put the pointer there. And this is how they grow up. Now, we did a Bavarian longitudinal study. That's Bavaria is in the south of Germany. That's why you see the flag when it's a Bavarian study, a British study, the Epicure study, which is the national study of preterm children under 26 weeks. Then you see the UK flag. Now, let me just show you here by social class. You see IQ differences. 0 would be 100 IQ, and this is -1 standard deviation is 85. So you see by social class, in the full-term children, you find the normal thing that you have got a lower IQ, the lower the social class. But now look at the preterm children. In each of the classes, the effect is of a whopping 12 IQ points by 26 years of age. These are children that are born more than 8 weeks early. And this effect we saw throughout childhood. They don't outgrow that problem. Now, if you look across the whole gestation range now, starting from 40 weeks going down, you find turning points around 34 weeks, and you find that with every week you decrease in your gestation, you lose 2.3 IQ points. And we can predict from the Bavarian data, the data in the UK, because when we did this study, these kids wouldn't survive below 26 weeks gestation. We can predict them. So what happens? Well, what happens to the brain of babies? This is a 24-weeker, and you know as you develop in uterine, you form your gray matter and your cortex, and you see the normal walnut pattern, which you see of the brain, which is cortical folding. As you go on, this is scanned. You take the incubator in the Hammersmith Hospital, now King's College. They can scan them weekly, putting the incubator in there in the intensive care unit and scan the brain development. And what you find is that by the time a child that's born ex-uterine has been cared for the 16 weeks, has got 40% less cortical folding at the time of term. So you need a lot of reorganization you have to make up postnatally. And we have followed up the kids under 32 weeks now, 26 years of age, and we find still at 26 years of age, particularly in the ventral brain, around the thalamus area and things, anatomical changes. And the anatomical changes are related to widespread intrinsic network connectivity differences, which are related to the cognitive function of these children. Now let me turn to the mental health of preterm children. What we find is a very clear phenotype of very preterm children. They have got about 3 times, the odds are about 3 times increased that they have got any psychiatric disorder.